set of exercises will focus on the sacroiliac joint. For short, it's called the SI joint. It's just a few exercises. There is not a lot of exercises for the SI joint, but we're going to show you the few that we decided is going to be the best for the purposes of this series. We are going to start with what we call force closure. It is a strengthening exercise of the SI joint where we use opposite muscles and forces that attaches to the SI joint. When they contract from opposite sides, the SI joint closes or strengthens. That's hence why it's called force closure. In order for you to see the exercise better, we are going to do it in this direction, where you have a right leg and a left arm that is going to press down simultaneously. It is important that the knees bend because we want to use the gluteal muscles as one of the components. It is important that the arm is straight because we want to use the lats as the opposite component. So you are going to simultaneously press your right leg into the bed as if you're lifting your bottom, but don't lift it as if you're lifting, while you press your entire arm down into the bed. And you repeat that a few times. Again, do not forget to focus on your breathing. Do not hold your breath when you lift. Exhale when you lift. And then we're going to change over and do it to the opposite side. You're pushing your left leg into the bed along with your straight right arm. You have to feel it in your shoulder. Your shoulder almost wants to lift. You can repeat this as many times as you deem sufficient for your body. The next exercise we are going to do is a combination of hip and SI joint movement. You can straighten both legs. If you feel that this puts some strain on your lower back, you can either put a pillow or a towel under your knees, and you can raise it as high as you deem fit for your body. The joint that we're going to mobilize with this exercise is her left hip and SI joint. We call it figure of 4. You place the foot next to the opposite knee and very gently open and close that extremity. You do a few on the one side and then you cross over, put the foot next to the knee, open and close. The third exercise, lying on your back, is position yourself quite diagonal because we need to drop one leg off of the side of the bed. But before you drop it off, you secure yourself by pulling the opposite knee to your chest. If this bothers your knee, you can add a towel. If it bothers your hip, you can stabilize it a little further away from your chest. It doesn't really matter that much. The focus of this exercise is on the leg that goes down, and we just need to turn a little more. You want to drop that leg as far as you possibly can. There you go. And now we get a twist. Because the one leg is pulled up and the other leg is extended down, we get a twisting motion on the SI joints on both sides. Again, you repeat this as many times as fit for your body. You can do it with a long lever and you can do it with a short lever. If you want to add a little bit of a knee strengthening exercise, you can lift it a little higher or bend your knee. Short lever using your hip flexors, and long lever using your hip flexors, getting again 2 birds with 1 stone. You're also going to repeat it on the other side. Come quite diagonal so that there's room for this hip to drop off. Let's do it with the short lever first. Repeat it a few times with the short lever until you're warmed up. You add the long lever, which is more difficult, and progress.